Brad, just to let you know, I have to hop off at it's like 2:30. So at the very end of the meeting, I have to hop off for another call.
Not a problem.
Okay.
Totally understand. Thank you.
Brad, just to let you know, I have to hop off at it's like 2:30. So at the very end of the meeting, I have to.
Sorry, that's on my end. Kelly and Sandy. Nice. Oops.
Hi, Brad.
Hi.
Susan?
Just let everybody know if I sound stuffy, it's because I have a nasty cold. Never been so glad to have a cold in my life and not COVID.
Not a problem. Well, we're happy to have you if you're not.
Thanks.
I was having a little technical difficulties.
No problem. I think we're close. I know there's a few folks who aren't going to be able to make it,
Got it.
but I think we're close. We'll give folks one more minute before we get started. All right. A couple more folks. I think we're in good shape. So welcome everyone. It's nice to see you. Thanks for joining today. Hopefully you can see the slide deck here. We are, I think, a lot of familiar faces, a few new folks. So I think we're going to start with just introductions. So this is the Transparency Advisory Council. So this is taking a step forward from the Transparency Board, which we published the final report. And this is today, we'll kind of go over the brief charter and then kind of a status of where things are. And you guys are welcome to ask questions and discuss. We have allocated 2 hours. I'm not sure if we'll need that full time, but we have it at least. And Susan Smith has been helping put this together. So we've been working on this together for the last little bit, and also on a lot of behind the scenes work, she'll be able to update you on a little bit later. So why don't we do brief introductions for everyone, just make sure everyone knows who everybody is. Just first name, and if you just want to say where what group you're representing, and I think that'll be perfect. So I'm Brad Richards. I'm the Medical Director and Chief Medical Officer at DSS. I'll pass it over to Susan and kind of pop around if that's okay.
Hi, folks. I'm Susan Smith, and I'm the Director of Business Intelligence and Analytics for DSS, and I'm very pleased to see you all again today. So whoever would like to go next.
Hi, I'm Donna Belosky. I work in the integrated care services. I use speech on my computer, so I'm going to turn off and mute. So when I respond, it'll take me a delay.
Great. Mike, do you want to say hello?
Sure, thanks. Thanks, Brad. Mike Gilbert, Deputy Commissioner of Finance Administration. Hello, everybody.
Great. And then I'll start in my top. Anne, you want to go?
Sure. Hi, Ann Spinard, and I'm representing the Connecticut Association for Healthcare Facilities.
Great. Mag?
Sure, I'm Mag Marley. I represent Leading Age Connecticut. We're aging service providers. Thanks.
Thank you. Sandy?
Yeah. Hi, I'm Sandy Carbonari, primary care pediatrician, and I'm representing the Connecticut chapter of the American Board of Pediatrics.
Great. Colleen?
Good afternoon. I'm Colleen Harrington, and I'm representing the Department of Mental Health and Addiction Services. Thank you.
Thank you. Grace?
Hi, I'm Grace Damio. I was previously at the Hispanic Health Council, representing a community-based organization. A lot of work done there on health equity and community health workers, and committed to stay on this committee until its work is complete.
Great. Kelly? There's two Kellys. Either one, whoever's going first.
Which one?
Cinco can go, and then we'll do you next.
Okay.
Kelly Phoenix.
Okay. Hi, I'm Kelly Cinco from the Office of Health Strategy. Thank you.
Hi, Kelly Phoenix. I'm an independent consumer advocate and a Husky member.
Great. Susanna?
Hi, Susanna Bernheim. I am a Senior Director of Quality Measurement at the Yale Center for Outcomes Research and Evaluation.
Karen?
Hi, Karen Siegel. I'm the Director of Policy at Health Equity Solutions.
That's Karen. Mark?
Hi, I'm Mark Abraham. I'm the Executive Director at Data Haven in New Haven, Connecticut.
Ben?
Hi, everybody. I'm Ben Oldfield. I'm a pediatrician and internist and the Chief Medical Officer at Fairhaven Community Healthcare, one of the community health centers in New Haven.
Nicole?
Good afternoon, everyone. I'm Nicole Taylor. I'm representing DCF.
I am very sorry. I'm actually not sure who's next to you. It might be. I know I'm missing, I think Byron, I see Byron Kennedy, and then there's one other person, and I actually don't think I know you, so my apologies. But Byron, do you want to go, and then maybe it's.
Yeah, Byron Kennedy, CMO at DOC, representing DOC.
Thanks, Byron.
And that other person might be me, Sharonda Carlos, Deputy Commissioner of Administration for the Department of Correction.
Sharonda, my apologies. It's very nice to have you.
Okay, thank you so much.
And then there's one other person who I also, is it Ashley?
Yeah, hi, good afternoon, everyone. My name is Ashley Murphy, and I'm representing the Office of Early Childhood.
Thanks for being here, Ashley. My apologies for that. It's nice to meet everybody. So thanks again for everyone for being here. I'm going to just briefly highlight, because I know some of you many of you were on the board before, and may not have had a chance to review the entire document. So I can send that out after this meeting for those who haven't had a chance to review the board's report for transparency work. Today, again, we're just kind of establishing some agreed upon charter between basically the DSS is proposing to engage with other folks to get feedback, advice on our ongoing efforts based off of the initial transparency board report. Before we get started, I want to make sure to ask Susan if she wanted to say anything else before we kind of started walking through the charter for today.
No, thank you, Brad. I'm all set.
All right, thanks, Susan. And Mike, I should probably ask if you want to as well. I know you were extremely instrumental in the early ongoings of this effort. So just if you'd like to say anything, you're welcome to. No need to otherwise.
Thanks, Brad. Nothing more to say than, appreciated the efforts of those who were on the earlier group in terms of coming up with the first round of work that we're now going to build off of, and looking forward to working with you and the new members who are on the team. Thanks.
Great. So let's just walk through the charter just so that we're all on the same page. Can send this out afterwards. Just want to make sure there's no significant corrections. And thanks for those who already provided feedback on this. I did make some slight modifications based off of that. So I'm going to keep it pretty boring and actually read through this because I think it's probably worthwhile for all of us to be on the same page. So this is from the report that we put out, or that the board put out Recommend the ongoing engagement of the Transparency Board as a Transparency Advisory Council to perform the following functions. Create a charter that is agreed upon between DSS and the advisory members that will help delineate the role of the Advisory Council in overseeing measure creation and development, measure portrayal, display and sharing, measure benchmarking, dashboard utility and ease of use, timeline for transparency work. At any time, I just want to welcome if there's any clarifications or questions. Please feel free to just even interrupt. I think we can do that. And as also one other thing, just since this is a public meeting, this is being live streamed on our DSS YouTube account. So if you want to go back and watch it later, which maybe you will, it's there for your viewing. So here's the proposal, and this is kind of our preamble for it. So under the authority of the Commissioner of DSS, the Transparency Advisory Council is established to advise DSS on the implementation of the transparency work as recommended in the final report from the Husky Health Advisory Board for Transparency on Medicaid Costs and Quality, which was convened under Executive Order 6. A charter will be established between the DSS and inaugural appointed members to outline the focus of the council membership and advising function. So the goals, council goals, so these, just read through them: identification of a core set. And these are actually from the final report. We're just implementing them formally into the actual work of the council. So identification of a core set of currently available equity-informed quality and cost data points that will be reported out publicly on a routine basis. Identification of a means of measuring program impact on population health, social determinants of health, and other areas that need further time to implement. Benchmarking our performance on the core measure set and also aspirational measures as that becomes feasible over time and against performance of other states. Visualization of data in accessible, plain language, electronic dashboard format that enables a broad view of measures for purposes of program accountability and continuous quality assessment and improvement. Drill down capacity for purposes of routinizing access to raw de-identified data, scheduled refreshes of the data, and push alerts to cue interested parties to updates. And this is verbatim from our final report, but just making sure we're putting it directly into the charter. Again, any questions or comments are welcome as we go through this. This is the council principles. Again, these are taken directly from the board's report. I do want to read through them just to remind us and refresh us as to what the principles are. Statement of intent: the data that is featured in the Husky Health Data Dashboard should be one used to illuminate the experiences and outcome of Medicaid members with an emphasis on achieving equity for all served, member informed, selected with a lens that safeguards against reinforcing preconceptions and stereotypes, and presented in a clear and comprehensible manner in formats that accommodate access by all who wish to use it. For this purpose, the term equity means that everyone has a fair and just opportunity to attain their optimal health and socioeconomic status, regardless of race, ethnicity, disability, gender identity, or sexual orientation. Further, the Transparency Board wishes to ensure that the Department of Social Services applies these principles across the life cycle of the data that DSS collects and manages. Again, this is coming directly from the report, which is why it references the board specifically. And this is just the equity framework that was designed and put together with several of the members, Grace and Karen, and I think I might be missing one or two other folks, but very influential in creating this language. And then the second principle slide, the process through which DSS selects, reviews, and sunset and replaces data points and measures for purposes of quality improvement must be equity informed, person-centered, member-informed, inclusive, and transparent. Whenever possible, data points should be standardized across the enterprise to reduce the reporting burden on Husky Health members and providers. Selection, use, and publication of data points and measures should safeguard the privacy, dignity, and health equity of Husky Health members. Within the above parameters and where feasible, data points and measures should be in support of health equity, routinely be disaggregated and publicly reported by race, ethnicity, age, and other demographic factors. When data is adjusted to account for age, risk, or other factors, both adjusted and unadjusted measures will be reported. Selection use of measures should anticipate and mitigate unintended consequences, including but not limited to inherent bias of data analysis tools, perpetuation or exacerbation of health disparities and inequities, under service of members, and or adverse impact on providers that serve a high incidence of Husky Health members. To avoid misperception, stigma, and perpetuation of health disparities, DSS should always use best efforts to identify and report out on a baseline or reference group and to provide contextual detail in reporting out disparities. So council focus areas include these 5. We already kind of went through this, but just kind of noting these issues, noting them again. The council appointees and roles. So this will go through because this is new. Members are appointed for one-year terms by DSS without membership limits on reappointment, which occurs August 1st every year. Membership entails serving as advisors to DSS. The council can be disbanded at the direction of the commissioner. Meetings will be periodic and will follow public accountability rules. Any questions or thoughts on this? And if you want to come back to it, please feel free to at any point. So that's really the charter. This is just, again, to establish a relationship between DSS and all of you, again, following our public accountability rules. And if there's any concerns, please feel free to voice them now, or feel free to send me a message. I'm happy to hear about anything. So I will pass it over to Susan. So we're going to kind of highlight where things stand. Again, and Susan, maybe while you're doing this, I'll actually send out to everybody the final report just in case they don't have it in hand, so that they're aware of the rest of it. So this is a snapshot of some of the what we went over from the charter. It includes a lot of the key thoughts from the work that was already done, but not everything. And it really just capsulizes a lot of the language that we want to keep in for this charter. But I'll send that out for everyone, and I'll pass it over to Susan.
Sure. So this is really kind of focusing on the visualization piece of the work. So based upon the quality measures and indicators that we identified, focusing on the ones that we prioritize in terms of being more accessible. Been working on some visualization concepts. As folks who have been involved know that we've been looking at this and perpendicular to work that had already started related to developing some enterprise dashboards. And there are certain things that are overlapping. So that process is allowing us to think about different ways that we can use some of the existing data, some of the utilization and population level data, and some of the data related to access to various programs, our SNAP or TANF, as well as obviously our Medicaid data. So I've been working with our metrics team, who are our Tableau developers, and which is the platform that we're using to develop the dashboards and to identify some proof of concepts, and thinking about the various levels of filtering that we potentially can do, thinking about some of the demographics that we can present, the geographic areas that we can do, filtering in terms of how far back also we can provide data. So very much thinking about, some folks may be familiar with the static people serve report that we do. So really thinking about how some of those data could actually be incorporated into our more dynamic format that's taking advantage of some of those data metrics and indicators that we identified. Related to this, we're doing work on our back end. So it's making sure that environment where those data are going to sit and from which they're going to be called is secure, that we're comporting with the state standards with respect to presenting these data publicly. I had kind of assumed, and really looking at some of the visualization work across jurisdictions, that this is kind of easy peasy in terms of you're visualizing in Tableau and you just kind of pivot it outward. But it appears that, and I can't say this 100%, but it certainly seems that there is some bushwhacking that needs to happen with this, that there hasn't necessarily been a lot of public facing data through the Tableau visualization, at least in Connecticut, and particularly that's related to clients. And so there's some security work that we really want to get tight on, and obviously making sure that there's no possibility of obviously breaching those data, and making sure that the underlying data that are being provided, even though it'll be aggregated, certainly wouldn't have any vulnerabilities. I just want to note, just in case folks do hear it, I don't know how percussive this is that there are folks who live below me in the condo I live who are getting work done. So there's sometimes some construction noises. So when I'm not speaking, I'll be on mute. But if you do hear something, I do apologize for that. So we're working on that. I think we are able to move forward with that work, but obviously we want to make sure that work is done with rigor and diligence, and that there is no possibility of compromise with any of these data. We've also been meeting with the ASOs to look at the data that they're producing for us as well as themselves, and what are those data that relate to some of our key data measures and indicators that we might also be able to utilize to populate the dashboards. Some of their data is already in the Tableau format. And so we've already started to meet with them, including our technical staff, to identify potential ways and what's the best pathway by which some of those data could be brought over to us, both visualized data as well as some of the unprocessed raw data that we also would have that we potentially could build from. And we are also beginning to meet with each of the ASOs individually to identify specific data points that they might have, and again, to work with them in with relationship to their particular systems and visualization platform with respect to how we potentially can utilize some of those data. We're also working on some innovations related to kind of our data sharing and our data contracting kind of process. And so we have been looking at this, broadly for not only our involvement with other state agencies, but also potentially, other stakeholders about ways that we can bring partners and other experts into the fold with respect to supporting analytics and research of our data. But just general data sharing. And so we're having conversations with one of our sister agencies to think about some mutual intersecting areas whereby there's data that we have that they're interested in. There's data that obviously that we want, again, in support of the transparency work that we've identified, how we can better share some of that data, how we can do so in a more nimble and fleet way. So we've been sitting down and bringing in our legal folks to see what type of master contract kind of arrangement can we use that kind of builds off of a single existing data sharing kind of agreement channel or vessel, and building off of that when we're needing certain types of data. So there's still we're still kind of in the nascent stages of that, but that might accelerate our ability to receive data, but also again to support the work that we need, that we want to happen with respect to getting some of those data from other state agencies. So we're hoping that this might be a model that we can use and extend to some of the other sister agencies, and bringing in some of those data and using that also to populate and expand some of the available visualizations on the dash. So that's kind of where we are. I know in some of our earlier presentations we had talked about wanting to start pivoting out forward some of those visualizations. Starting this fall, we are still trying to hold to that time frame. Some of the work that related to the back end is also going to very much drive whether or not we can hold to that time frame. But we are in our conversations with the ASOs, we have told them that we're trying to be very ambitious about this and really do want to start with some nascent early visualizations of some of our readily available data. And trying to get that out, so at least we can start to stand this up, start to do some of that, getting some feedback and thoughts about whether or not those visualizations are supportive of the work that folks are doing. So we're still trying to maintain as close as we can to some of the timelines that we had articulated earlier along this process.
Susan, I'll just thank you very much for that overview, and I'll just add a little bit, just because I know some folks may or may not be as familiar. I know a lot of people are very familiar with our ASO structure, but just to make sure that everybody is in terms of, so ESS, we contract with administrative service organizations. We have 4 of them. So many of you maybe are very familiar with CHNCT, Beacon, Medicare, and BAO, who are various contractors who help operate basically the front-facing portion of Medicaid CHIP services, additional with a few other things. But then so one of the challenges, and I'll just kind of repeat a little bit, rehash slightly differently what Susan said, just because as a less technical person, it may help. I know it helps me sometimes to hear it slightly differently as well. But a lot of the data that we have a large claims database as well as other data that we send out to our ASOs to help with a lot of the management of the data. So they actually get files from us to do it. And we don't actually we do some of it in-house. We do some data analysis in-house, but most of it gets done externally. And so as I think we've discussed, and actually some of the principles include making sure we basically have a single source of truth for a lot of this information, really can explain it and understand it. And since we're sending it out right now, and then initially we're probably going to be asking for data back that we can then put up on the site, we just need to make sure we're understanding how this data has been manipulated. Claims data, as some of you may know, is quite messy at times and actually requires kind of massaging to get the data into a place where you can then show the information in terms of putting it into categories, et cetera. And so it's just adding a little bit more complexity. I think in the long run, we're going to be trying to do this more in-house so that we're not relying on 4 different folks to do modifications to the data and then sending it back, so that we can ultimately have it'll be a lot easier to display the data when we have kind of our own files and understand exactly how we've done the logic and manipulated the data behind the scenes before we display it. That's going to take a while, understandably. And so we're kind of going through this process where, kind of as Susan already outlined, we're going to be working closely with the ASOs to get the data they already had and we're already sent. It's already our data. It's just they're the ones who are manipulating it, have already processed it, which is pretty labor and time intensive, as you can imagine, given the amount of data we're sending them. Get it back so that we can then display it for now as kind of a temporary step towards ultimately being able to do this in-house, which and Susan, hopefully I try to condense it. Did I do an okay with that?
No, you did an excellent job. No, that's wonderful. And I think, just also prime the point for me is that, relatedly, getting from the ASOs also that meta, that dictionary, kind of data level data, so that we can also do some of that piece that we know is going to be integral to the understanding of that and creating the guidances that folks will need in order to access those data. So that piece of it also is a part and parcel, and does take some time to translate the kind of how did you do this and what does it mean and how do we represent that so that it's understandable to us as well as our stakeholders.
Well, I want to open it up for questions, comments, thoughts to the rest of the council, or concerns, any of the above. Again, welcome to hear anything. I think for those who are on the board, before, I think we were hoping to have things a little further along. I know Susan and I both were hoping for that, though maybe not surprising to any of us. There's some technical complexity on the back end to doing this and making sure there's no privacy issues with any of the data we're publicly displaying. But with that said, let me turn it over. Please feel free to interject. If you want to raise it might be here. I'll stop sharing just to make it easier for me. If you want to raise your hand, be my guest. I'll happy to call on folks. Either comment, again, anything's welcome. Comments, questions, thoughts, concerns. Kelly, please.
Please, can you hear me? I have a power outage. I didn't know.
Yes.
Can you hear me or no?
I can hear you great.
Oh, you can? Okay. Okay, great. Yeah, so I wanted to thank you both and Susan for the presentation. I think it's excellent. And I also just wanted to say from the OHS, Office of Health Strategy perspective, any way we can align with Executive Order 5 or any of the work we're doing on data, we're definitely committed to that. So thank you. And we look forward to working with you on these efforts.
Thanks, Kelly. Appreciate your effort. And I know we've been engaging in lots of your own work, so I look forward to continuing that.
And if I can just also add, Kelly, also related to the work that you guys are doing related to Section 11 of Public Act 2135, we're also thinking about that in terms of the representation of our race, ethnicity language as well. So we are trying to think about how we align, how we present those data with that Public Act as well. So I very much appreciate the extension of that offer and wanted to let you know that we're also thinking about that aspect of it as well in terms of how we present these data.
That's excellent, Susan. And we actually are going to have something to share with you quite soon. So we very much appreciate your comments and everything you've done as well for the feedback on that. So thank you.
Susanna, please go ahead.
Yeah, I just trying to be clear on the privacy piece. I feel like some of the measures we had talked about that were more sort of global preventive health fit already in maybe it's a DPH. I'm not actually sure anymore. Dashboard, and so I don't know whether there's a there's a sequencing where some things have already been made public and could be pulled over. Or do you have to kind of get all this back end work finished before anything can go up as a part of this? Just trying to understand
Great question. And
what the sequencing would be.
So, and Susan, I'm happy to start and then I'll pass it over to you. But there's really, I would say the two first big buckets of data are really our own DSS data. And then the second one's DPH, probably related, which Susan kind of alluded to that. I don't think it's probably anything we can't discuss, but that's the sister agency we're working to create some master data sharing agreements or DUAs, data use agreements with. And so it's doing both at the same time so that we can, and just to be clear, we already have, there's multiple, agreements between our agency and DPH already. We're just trying to streamline this for moving forward because it seems there's a lot of small agreements about specific data, but obviously as we're talking about DPH data for this, there's a pretty expansive list. And for those who haven't seen, if you go to the appendix, you'll see the list of all the measures that we initially identify as part of the board. A lot of those are DPH measures and from other agencies, but we're starting there because we know that's the agency that probably has the most data that would be relevant for the board, and it would be a good use example if we can get that off the ground. So we can't promise anything. It is in the works because I think it will benefit both agencies in the long run. But I appreciate that question. And you're right, their information would not be a privacy concern necessarily. They'll be probably sending aggregate information, though they actually do have some individual level data that we might be able to match around birth data and other things, which some of this will be require. So some of it's also, how do we take some of their data that is individual and we match it with our own data, and how do we, so there's going to be a lot of questions about how we do some of this, and do we have the capacity to do all of this work internally? So just to put that out there, I'm sure there's some DPH data that will just be able to say, here's the rates of, whatever we want to say, but then some of it is, well, here's the birth cohort data or the birth file that has individualized data, and we can actually match it to all of the Medicaid members because we actually have that information to link. That's going to be a heavier lift, I think, if that makes sense. Susan, please let me pass it over to you.
Well, sure. I mean, I am not the expert in some of this, but as I kind of understand it, it's really kind of how the data gets called. And so when we're talking about data that might be dynamic, so filterable, that some of the underlying data that exists that allows for that to happen potentially is, could be identifiable, because again, you're talking about a data set that includes all these different components, even if we're not including a person's name or a particular ID, but because it's at that client level in a row, and it needs to be called up in order to allow potentially for filtering by, disaggregation by, by gender or disaggregation by race. That's where you want to make sure that there's no potentiality that back end could somehow get breached and get entered into. So that's really the piece of it we need to make sure that there isn't. And so where does that data actually sit? And, and what's the firewall with that, so that when it gets called, that there isn't some way that someone could kind of somehow back into that. So that's kind of really where, if we're talking about any data that potentially is filterable and dynamic, but you're absolutely right. If we're just wanting to do static data and put it as, as an unfilterable dashboard at this point, that would certainly accelerate it. So if that's, something we want to, talk, about, we could do that. There is some ways, I did kind of pose that they can kind of do a mix and match, but again, it would just be a question of which components of it, do we want to do with that. But anything that would potentially allow for folks to do any kind of customization, we do need to make sure that there isn't any potentiality for anyone to potentially get into that end of it.
Thanks, that makes sense.
The only thing I'll just say, I think kind of along what we're just discussing, is that there are kind of these parallel phases all going on at the same time. And I think realistically, and we include, I didn't include them here, but they're in the final slide deck for different phases of approach, including development of new measures eventually. I think realistically, the capacity for us to do that internally isn't going to be there until, some of it is getting data from other agencies, getting our own data in order, getting the technological components so we can safely share it and not worry about data privacy. Obviously, those are going to be probably some of the first things we want to do, along with trying to make sure in the future we're collecting better data around REL, which I know Susan just mentioned. And so some of these things, well, I think hopefully set a really good foundation for the continued evolution of this over time, recognizing that some of the later on, like the measure development and creation may be challenging, at least internally for us to do right off the bat. Not that it's not important and we want to, I think we all identified, or those of us on the prior board identified the desire to, whether we want to use that term aspirational or not, but we want to be looking to put together metrics that really aren't currently developed and gathered, but that we will be focusing on moving forward. And I think that will be a priority once we can kind of get some of these threshold, things off the ground. Karen, please.
I apologize if I just missed this, but is there a timeline for the initial release of data?
Great question. We did have a proposal in the board. The board final, which I'll pull up here. I think we have to modify it, and I'll defer a little bit to Susan on some, because some of this is technical issues that I can't speak to, but Susan, do you want to comment? And I'll pull up the old one.
I think we were looking at, we're talking about some of the phases. I think it was September through December would be where we were looking to do the launching of the initial dashboard. So I am still hopeful that we can hopefully provide something, critical mass of data points by that time frame. It's certainly not going to be everything that we want with it, but we are trying to see if we can get something that provides a certain cogency of information that would allow us to present it within that kind of a time frame that we discussed earlier in the process.
And I think just looking at our prior deck, I think the initial hope was
September.
Publish something in September and then enhance in December. But
yeah.
We may be pushing that. Again, I think one of the questions is like, how soon can we get a minimal viable product, or just something that's static even off the ground? And that's still, I don't think we're not quite there yet even. But Karen, appreciate it. And this is part of your guys' advisory role to us, obviously, is to provide this feedback, and for us, for you to help guide, where our focus should be and things along those lines too. So appreciate any thoughts you have on that. Go ahead.
Yeah, well, I would just say I understand the complexities, and that makes a lot of sense. It would be great if we could just get some static data updated on the open data portal. Like, for example, enrollment by race ethnicity was released a couple of years ago. There was a report created and released, and we were told it would be regularly updated, and it really wasn't. There is still some enrollment data, but not by race and ethnicity. Just getting some of that basic demographic data, enrollment by town, enrollment by race, would be really, I think, useful to folks who are trying to do policy analysis and advocacy.
Appreciate that. Yeah, I think that's a little, not that that's not important, the open data portal. I don't know, Susan, if that's something you're engaged with or not, but the only concern I would personally have is that effort may take away from us trying to get out live on a new portal, if that makes sense. Not that that's not important or shouldn't be done. I can't comment on that. Susan, I don't know if you have anything you want to add.
Yeah, I do, they are kind of interrelated, but I can certainly go back with folks and see kind of where we are with some of that. I can tell you, Karen, that the geographic and race ethnicity level demographics were areas that we're kind of prioritizing with this. And so again, we were looking at the static people served report, and so kind of looking at those data and actually how could we make the, kind of visualize, some of those, because like obviously that's inclusive of a variety of programs across the enterprise. And so I can go back with folks and see, if that aspect of it, is something that we can accelerate, because it definitely was something that we were presenting on our proof of concept dashboard at a higher level. And we were looking at adding a kind of a filterable level by program type. So I will not making any promises, but certainly I will go back to folks and see about whether or not that aspect of it is something that we think we could move forward either through the dashboard or potentially taking some of what we've done and use it to populate the open data portal.
Thank you. Yeah, that people served report is exactly what I was talking about. That's
yeah. We're using that actually as kind of our foundation. And so, rather than having that static, well, wouldn't it be great if something like that could be made dynamic? So that's what we're using to think through. How can we just use these key, high value data points and what would they look like in a dashboard type format?
No, that's terrific. And I, not to beat a dead horse, but I think, not to let the perfect be the enemy of the good as we move towards a much better visualization kind of tool.
Oh, yeah.
Great to have just something that those of us who are actively working on data analysis now would appreciate. Sorry.
No, understood. No, appreciate your comments. Absolutely.
Thank you, Karen. I just wanted to offer, if anyone would like to have a follow-up, or especially for those who are new, if it would be helpful to have a brief meeting just to kind of review in kind of virtually some of the work that previously was done, if that would be helpful. I'd be happy to make myself available for half an hour at some point in the next few weeks, just if that would help with any clarification on anything, because I know we kind of didn't go in detail into the final board report, but especially those who are new, I'm just happy to do that. So please feel free to send me a note. I'd be happy to find time. I have not seen any more. I'll just say, I think one of the things thinking about for follow-up for this council is that, I personally was thinking we'd probably meet somewhat monthly. I also don't want to overburden us with scheduling meetings, especially as we try to get this off the ground. Realistically, I know Susan and I have several meetings scheduled over this next 2 weeks with trying to facilitate some of this data transfer. And my guess is that we'll move forward, but that's where I think, just to give you guys a preview of what's happening, is basically a lot of meetings internally and also with our contractors with the ASOs to get the data that we need. And I know Susan's having other meetings about just getting this dashboard off the ground. We could meet in a month. We could also do 2 months. I actually would defer. I'm happy to personally do which either of those makes sense. I don't want people to feel like we're pushing this off. And if kind of the group feels that it would be more useful to meet in 1 month versus 2 months, I would welcome that. So I just want to kind of steer us in that direction, seeing not a lot of other comments at this time. Again, just be mindful. I know that people are very busy and don't want to waste people's time, but I also wanting to make sure that feel like you're able to hold us accountable as part of this process. So maybe I will, I see Nicole, you raised a hand.
Thank you. It took me a while to find it. I'm so used to Teams. You may have discussed it already, but yeah, I wonder, so I know that we're not at the point where we're ready to share the data yet, but how about the design of the dashboard? Has that been completed yet? And if not, is there a timeline for that to share with the board?
Susan mocked something up, but I'm not sure that's exactly what it looks like before. Susan, I don't know if you have anything you want to add to that. I imagine that these kind of are complementary pieces where we'll need we need the data to have it so you can present it in such a way. I actually think that's probably the Tableau software, I think kind of already facilitates some of this on the software side, but Susan, please weigh in because you're the expert and I'm.
Yeah, I mean, some of it is, is kind of that is interrelated. We kind of did like a base, proof of concept dash that started with kind of filtering by year, so you can filter by a year, so it goes out. We were trying to go out as far as we could to like 2012 or something like that, and then would allow for clicking on certain things would give you like the town level, and then then update the race and ethnicity. But again, whether or not that's ultimately how it's going to work, is going to ultimately look, we're still trying to kind of play with some of that, and we're adding pieces to it. So as we kind of like, here's kind of the base, and is that working? Well, what would it look like if we kind of add this element of it? So we're kind of taking it. So it's been kind of this, it's almost been like Legos, kind of like, here's a piece of it. So we potentially could get to, here's a kind of a concept of what it is. But it may look a little bit differently if some aspects of it are filterable and others are going to be static. So it's going to be hard to say this is exactly what it's going to look like. So at some point I could certainly give folks like, here's kind of what we're playing with. But it may look a little bit different when we get to the actual launch, fully, realized viable product state.
Susanna.
Sort of a similar question, and again, sort of thinking about your request, Brad, about whether we should meet next month or not. Are there details about sort of some of the actual specifications for some of the measures that need further thought? I'm just thinking about things we could be supporting in parallel while you guys are working out the complicated back end stuff. So, I'd say it's great for us to meet in a month if there's ways that we can be helping nudge other aspects forward. So either looking at mock-ups and giving some feedback, or going through some of the actual specifications of the measures, even if you're not ready to present something.
The answer is maybe, I think here, unfortunately. So some of it, because we're going to be asking the ASOs for what their current definitions are and their logic behind it, which ultimately may be really helpful to discuss together. I'm just not sure how readily we will get that sent to us and be ready to share it and make sure we understand it. So we had to push back a meeting yesterday, but in the next week we'll be meeting, I think, at least with 2 of them. So we'll probably have a better sense. So unfortunately, I don't know. Susan, what do you have thoughts on that?
Yeah, sorry. Yeah, I think that's kind of the wild card with it is the information that we're getting with the ASO. I think will certainly impact some of the next level of visualization and the pieces of information that we're able to add to this, and then obviously what type of meta information they have readily available that helps to explicate that. So I do think that would actually be a great role for the group, particularly in terms of helping us to unpack some of those metrics and really make sure that it's providing the indicators that the indications that we want. But again, until we get to that individual, into getting that individual information and data from each of the folks, it's hard to kind of say how far we're going to be able to get by next month.
And we can always.
So it sounds like Ben. Go ahead.
I was just
going to say exactly what I was going to say, Brad. You could put it
I'm
on
not
the
sure.
board.
I was just going to say we could always schedule it for a month and 2 months, and then if we don't have it, we can just cancel the next one if we're not ready.
Yeah, and I think from the accountability standpoint, I mean, that's what I was going to suggest, is that there's things that aren't ready to be fully fleshed out, but you're ready to get some advice on. I think you've got a group of people who are eager to help you move this forward. And if you need to cancel, maybe just make sure we get kind of an update on where things stand, so that there's a sort of a sense that we're seeing progress, but no need to bring us together if there's not things we can help with. Sorry, Kelly had her hand up and I spoke out of turn.
That's all right, Suzanne. Thank you for your input. And Kelly, please go ahead.
No, that's okay. So, Susan, you keep referring to the ASO. Which ASO were you talking about?
I mean them all. I said the ASOs. I'm sorry if I truncated it. The ASOs.
Okay, so Beacon, CHN, Medicare, Bayo. Well, Bayo's not an ASO, but okay, so it is.
I mean, kind of using it ubiquitous ASO data, like from the ASOs, like ASO data,
So it's all of them. Okay.
Yes.
Just
Yeah.
wanted
Yeah.
to clarify.
Yeah.
Thank
Yeah.
you.
You're welcome.
And you raise a good point, Kelly, and I'll just, again, to clarify is that they're getting their data feeds from us. They get an ASO file, and then they, again, do all the backend work individually, which means that you might have data that slightly conflicts with one another if you compared them between the ASOs. And just means that at DSS need to make sure that we're not presenting data from one that conflicts with another one, because that's obviously going to be very confusing and also create a lot of mistrust as well if we can't explain it. So
Are we basing it on claims or approvals?
I mean, I think most of it's going to be claims based because that's the large data set that we have and that's mostly what's being utilized. There is some additional data that's brought in from a few of the ASOs, but it'll be mostly claims based.
Okay, thank you.
Which we know is not an imperfect data set. I think we all know that, but it is a big data set and we'll have a lot of information for us. Thank you. So I think Susanna kind of made the proposal. We schedule for something in a month. If Susan and I are unable to have something that's quite ready for prime time or even getting some basic advice, obviously we need to be able to explain it to you before we show it to you to a degree, probably. So I think we'll have a better sense of that in the next week or two, and then can decide whether or not we need to push it back 1 month or not. Does that sound like a reasonable? I know that's kind of I want to make sure we have input from everybody, or at least people's tentative approval on that. Seeing a lot of head shakings. Anyone think we should just do 2 months? I mean, I open to whichever. See some head shaking against that, at least a little bit. So I'm going to take that as tentative approval. We'll do a month, and we'll schedule it at least a couple months in advance, and then if we need to, we'll cancel the next one. But we can always provide you with a written update, at least as to we're still waiting on additional data. Just remembering that since this is a public meeting, like we can't do exchanges over email. They have to be like, this is a Kelly at OHS has helped remind me of those rules very kindly, being in some of those other meetings. So want to make sure that this is a public forum and will be publicly viewed, and people can go back and watch this if they want to. Okay, so I think we have a tentative plan. I want to make sure there's no other comments. After we wrap up, I'll ask Jody to schedule us out for 1 and 2, probably 3 months out at least, and then we can continue. We'll figure out what the cadence is going to be moving forward after that. Be a lot of thumbs up. Well, Susan, any final thoughts as we kind of see if anyone else wants to raise their hand, make any other comments?
No, just, as always, I'm just, happy to be working with y'all. I think we had some really great ideas, and looking to move those forward and obviously just continue this work. So thank you all for agreeing to participate.
Yeah, deep thanks for myself, and also I know the commissioner was grateful for us to continue to have such a great group of experts that are here and helping us with this from various backgrounds. I think the effort is going to be well worth it once we have something that we can show, and it's greatly appreciate all the input people have already provided and will continue to. So thank you. And Mike, I don't know if there's anything you want to add before we wrap up.
No, just echoing, the thanks and, the closing remarks of both you and Susan. Thank you, everybody.
All right. All right. Without seeing any other hands up, I think we'll close. You'll see an email from me. You'll see in the report already, just for those who hadn't. Again, welcome connecting with anyone about this or the prior board report, if that would be helpful in any way for background or information. And then I will send out a request to Jody Brindley, Elizabeth Brindley, who will help schedule 3 meetings, at least for the next 3 months, and we'll see about canceling the next one if we need to, if we don't have information. Okay, thanks everyone. Greatly appreciate your time. Hopefully get a little time back, a decent amount of time back. I think honestly, Susan, I wish we could show you a little bit more today, but I think that's hopefully in the future we'll be able to do that moving forward. So thank you all. Look forward to continue to engage with you.
Thank you.
Thank you.
Thank you.